How to use an AED. AED, which is short for automated external defibrillators, are designed to save lives in a cardiac arrest. They are simple to use and will guide you through the process via an audio prompt once the device is turned on. All you have to do is simply turn on the device. To continue anything further, we need to gain access to the patient's chest. Simply take off the shirt, lift up the jumper or undo buttons of the patient's shirt to gain access to the chest. Remember to look out for any chains the patient may be wearing. Look at the patient's chest. Is it wet? If the patient has a chain, take it off. If the patient's chest is wet, damp it down or pat it down with any clothing just to get rid of any perspiration. This is because any chains or any wetness of the patient's chest can have effect on the actual shock delivered. Attach both pads using the picture instructions. The pictures will show you where to place them. Place one pad on the right side of the chest, just below the collarbone, and place the other pad on the lower left-hand side of the chest.
Apply pads. Plug in connector. Apply pads. Insert connector firmly.
Then, all you have to do is attach the pad connector into the AED machine and wait for an audio prompt. The AED will analyse the patient's heart to determine if a shock is required. The AED will advise if a shock is required, but you need to remember to keep away from the patient and get anyone else who may be touching or near the patient to clear.
Stay clear of the patient. Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
This is to stop you from receiving a shock once the shock is delivered. You don't want to become a patient yourself. Once the shock is delivered, you need to continue with chest compressions at a rate of 30 to 2 rescue breaths. The AED will allow you to do this for a further 2 minutes before the AED analyses for another shock. Continue doing this until the patient becomes responsive or help arrives. If the patient becomes responsive, place them in the recovery position and wait for help to arrive. Remember to leave the pads on just in case the patient goes back into cardiac arrest.